Order. I call this meeting to order. This is the Standing Committee on Veterans Affairs. My name is Chris Palmer. I'm the MLA for Kings West and chair of this committee. Good afternoon, everyone. I'm just wondering who's actually working in the government today, because you're all here, I think. But great to see all of your faces here. Welcome. Today we'll hear from presenters regarding the impact on veterans and military families amidst a cost of living crisis. At this point, I'd like to ask everybody to please turn off your phones and put them on silent. And in the case of an emergency, we will use the Granville Street exit and walk up to Grand Parade. I will now ask the committee members, beginning on my left with MLA MacDonald, to introduce themselves and their constituencies for everybody to know. So, MLA MacDonald, we'll start with you.
Thank you, Mr. Chair. I'm John A. MacDonald, MLA for Hants, sitting in for Danielle Barkos.
Good afternoon, everyone. Larry Harrison, MLA for Colchester, Musquodoboit Valley.
Good afternoon and welcome. I'm Tom Taggart, MLA for Colchester North.
Good afternoon. My name is Steve Craig. Very pleased to be here with you. I'm the MLA for Sackville-Cobequid. And when I was much younger, I called myself a Navy brat. So I'm very interested in this topic today. Thank you.
Good afternoon, everyone. Thanks for being here today. Susie Hanson, the MLA for Halifax Needham.
Good afternoon, everybody. I'm Braden Clark, MLA for Bedford South.
And I'm the MLA for Hammonds Plains, Lucasville, Ben Jessom. Afternoon, everyone.
Thank you, everyone. And for the purpose of Hansard, I'd like to also recognize the presence of Chief Legislative Counsel Gordon Hebb to my left and Legislative Committee Clerk Tamara Noseba on my right. So, as I mentioned, our topic today is the impact on veterans and military families amidst a cost of living crisis. I would like to ask all of our witnesses who are at the table if they'd like to take a minute and introduce themselves, and then I'll come back to anybody who may have some prepared opening remarks to give those. So I'll begin with Ms. Embrett.
Good afternoon. I'm Tracy Embrett. I'm the Executive Director of Child and Family Wellbeing with Community Services.
Hi there, Joy Knight, Executive Director, Employment Support and Income Assistance with Community Services.
Good afternoon, Melissa MacKinnon, Deputy Minister of Community Services.
Good afternoon,
Dana MacKenzie. I'm the Deputy Minister for Intergovernmental Affairs.
Good afternoon, Darryl Eisan. I'm the Director of Military Relations with the Department of Intergovernmental Affairs.
Good afternoon, Shelley Hopkins, Executive Director for the Halifax and Region Military Family Resource Center.
Good afternoon, everyone. My name is Erica Fleck. I'm the Director of Emergency Management for HRM.
Good afternoon, everyone. My name is Craig Hood. I'm the Executive Director of Nova Scotia Nunavut Command of the Royal Canadian Legion.
Thank you all. So I'll maybe just ask who might have prepared remarks by show of hands. Opening remarks? Okay. So maybe what I'll do, I'll begin with Ms. MacKinnon, and we'll go that direction. So Ms. MacKinnon, for your opening remarks.
Sure, and I'll be very brief, recognizing you have the opportunity to speak to me more so than our folks here. With me today is Joy Knight and Tracy Embrett, and I first just want to acknowledge while we're here the contribution of veterans and military families in all times of war, conflict, and peace. I know that comes with sacrifice and challenge that we know can be exacerbated when everyone is struggling with cost of living. While our department doesn't have specific programming for veterans and military families, they would be able to access various programs and services, and we would work in collaboration with some of our colleagues here today. My thanks and appreciation to all of you here today, and I just look forward to listening and being part of the conversation.
Thank you. Ms. MacKenzie?
Thank you, Mr. Chair. Good afternoon, and thank you for the invitation to join you this afternoon. As Deputy Minister responsible for military relations, I appreciate the opportunity to be part of today's discussions about veterans and military families and the rising cost of living. Canada's military has long played an important role in Nova Scotia's social and economic fabric. Home to Canada's largest military-based, the East Coast formation of the Royal Canadian Navy, an innovative and competitive aerospace and defense ecosystem, and soon to be home to the regional office of NATO's Diana, this presence presents a major employer, a conduit for public safety, security, and a critical economic generator. It also represents thousands of people who become important members of our communities. whether they be military members and their families or veterans. While Nova Scotia does not have legal or policy authority with respect to the military and its affairs, that rests with the federal government, the military relations portfolio was created in 2006 in Nova Scotia to establish a central point of contact within the government of Nova Scotia. We communicate and work directly with federal agencies, including the Department of National Defence, the Canadian Armed Forces, and Veterans Affairs Canada, and we frequently meet with regional military and veterans-related organizations. These connections are important for understanding any challenges facing this community and helping ensure the needs of our veterans, military members, and their families are met. And in this time of higher inflation, we know many families are struggling. As a province, many of our programs and investments can help. Things like reducing childcare fees, increasing the seniors care grant and heating assistance rebate program, and work being done to improve affordable housing options are available to military families and veterans. A more concrete example that directly supports the military community is our work with the Seamless Canada Steering Committee. Briefly, this committee was launched by the Department of National Defence to alleviate stressors imposed on their members and families when posted to another province. The committee focuses on the priority areas of spousal and partner employment, access to health care, and child care and youth education. Here, Intergovernmental Affairs has been working with the Department of Labour, Skills and Immigration and Seamless Canada to help military spouses, partners, and families in securing employment upon their arrival to Nova Scotia. This work helps to raise awareness and access to provincial employment supports, ensure a collaborative community approach to available resources, and remove residency barriers to accessing employment programs and supports. Nova Scotia has a strong interest in the well-being of our military community, and we're honored to work with these other partners to support them. And like my colleague, Deputy Minister MacKinnon, I'm very much looking forward to the discussion today. Thank you.
Thank you. Mr. Eisan, I believe you had some... No? Okay. Ms. Hopkins.
Hello, thank you for the invitation. The Halifax and Region Military Family Resource Center is a nonprofit charity organization whose mission is to strengthen the well-being of all those who share the unique experience of military life. It is governed by a volunteer board of directors that must be comprised of 51% military family members. Of all 32 MFRCs across the country, we are the largest, serving the largest operational base of approximately 10,000. We serve all three CAF elements here, Navy, Air Force, and Army. Geographically, we are responsible for the Halifax and region up to Cape Breton, basically all of Nova Scotia except for the Valley. We have 2 full-time sites at Windsor Park and 12 Wing Shearwater and a satellite office in Cape Breton. As a nonprofit organization, we are agile and responsive with an ability to reallocate resources quickly and efficiently. For example, we served 38 families who needed accommodations during the wildfires. Military Family Services is our primary funder and steward of the program. Donations and grants support our non-funded services, such as our specialized and respite childcare. MFRC services are tailored to address 3 unique challenges of living the military lifestyle: relocations, absences, which is inclusive of deployments and training, and transitions, so transitions into the military life and military to civilian life. Our services are vetted through the lens of these 3 challenges. We do not duplicate services, but rather navigate and connect families to existing services within the community. We foster partnerships and cultivate relationships with CAF and community agencies. We apply a family-centered approach as we recognize each military family has their own unique situation, and we allocate our resources to meet their unique challenges. We remain current on Canadian military family research and solicit ongoing feedback from families. This ensures that we remain relevant, offering services that best meet their needs in ways that work best for them. Our services are available in person, virtually, or by phone. We have a 24-hour information line unique to our MFRC, answered by a live person who can implement urgent support. We feel this is a necessary service in Halifax due to the high operational tempo of the Canadian Armed Forces here. In a broad sense, our services include mental health and well-being, family counselors, information and referral, youth engagement and school outreach, navigation support, including navigating through provincial systems, military lifestyle education, connection programs, including those for Francophones, community engagement, outreach and events, 6 short-term accommodations, emergency family care assistance, education and advocacy about the military family experience, career and employment counseling, veteran family program, and financial resources. CAF families are faced with the same challenges as other Canadians, but their situations may be compounded by relocation, absences, and transitions. When it comes to the impact of the cost of living, like other families, there could be one situation that tips a family into financial stress or hardship, such as the holiday season. Maybe it's a fuel bill, legal costs of family breakdown or custody, or maybe even a vehicle that breaks down. Relocation can compound a financial situation because when a CAF family is posted to Nova Scotia, the CAF member is required to report for duty, sometimes immediately. This makes securing housing and spousal employment more urgent. This sense of urgency can impact their options or place families in financial stress, such as purchasing a home outside their affordability range or purchasing a home before the spouse has secured employment or is even aware of the job market. It is not unusual for a spouse to expect their employment in Nova Scotia will be a similar pay in salary, only to discover that it may be actually $20,000 less than their outgoing province. Relocations affect continuity of spousal employment, which in turn affects the family's income. Factors such as not able to build seniority can limit promotional opportunity to earn more income, or the cost of recertification in a new province. 60% of military spouses today have post-secondary education. We are observing a trend over the last few years of career transition with spouses versus spouses who in the past would have looked to secure a job simply to get them through to their next posting. From a financial literacy perspective, the CAF member may not be the highest income earner in a household. This may or may not be a consideration in accepting a posting or the spouse accompanying them on that posting. Imposed restriction is when a member moves without their family. This has its own challenges impacting family togetherness for a supportive unit. Families are considering this more due to the housing costs, among other factors, such as the grade levels of their children. 2018 research of Canadian military families showed adolescents are the most impacted by relocation. Other financial considerations include cost of health and intervention services for children with special needs. Services vary by province, and CAF families continually restart these services with every move. Elder care supports and services, dependent parents are the new trend that we are now observing, that many CAF families are actually have parents living in the home with them or are responsible for the care of their elder parent, which is affecting their relocation choices. Some financial resources our MFRCs offer include grocery cards, gas cards, those types of financial resources to address smaller gaps. Short-term, fully furnished, 6 short-term fully furnished apartments. They are not a housing solution. They are short-term stays for things like hospital treatments, gender-based violence, a parent living outside of Nova Scotia who's perhaps coming to visit an ill and injured member in the hospital. It could be for your home is unsuitable for a period of time due to fire, flood, etc. When families stay in our short-term accommodations, they do not have to incur high costs of hotel stays or restaurants, those kinds of things. Veteran Farm Project Partnership is one of the financial resources we had available this year. With the Veteran Farm Project, they provided fresh boxes of food to families who could pick up at our MFRC. Our Op Dasher program is our financial support during the holidays program, and the usage doubled in 2022. Our latest initiative is our community pantry, which we stood up on November 24th, and it was stocked with food items and personal items, and it will evolve based on the emerging feedback and gaps that we see from and hear from families. This service is military families supporting each other with a take something, leave something approach to provide an anonymous service. Some of our financial partners include Together We Stand Foundation, who helps support us with grocery gift cards, Support Our Troops, which provides larger funding needs and funding for special needs supports for families, and SISIP Financial, a CAF resource offering financial counseling, literacy, and loans. Military family life also has many positives. Research shows high rates of resilience among spouses who adapt quickly to relocations. Many families embrace postings as an adventure with new opportunities. MFRCs exist to support families to mitigate the inherent challenges of the lifestyle. Family readiness equals CAF operational readiness. You cannot have one without the other. The family having the resources to remain a stable family unit and build resilience is an essential consideration for recruitment and retention of the Canadian Armed Forces.
Thank you, Ms. Hopkins. Ms. Fleck or Mr. Hood, did you have an opening remark? Okay, Ms. Fleck.
Thank you very much, Mr. Chair. And I apologize, I wrote these great notes and they're sitting on my desk in Dartmouth, so going by memory. And I just finished vacation yesterday, so please bear with me. So good afternoon, and thank you very much. I would like to, Shelley, that was so well said. You covered a lot of the points that I was going to mention. I just want to ask that, or say that, not only as in my job as the Director of Emergency Management for HRM, which obviously covers, almost half the province, but also having worn a green uniform for 38 years. So I've been posted. I've been through all of the things that Shelley talks about. My husband is still serving. My youngest son is now in the regular force as an officer doing university. So this is lived experience and then some. What I would like to say is people are turning down postings to Halifax. They are releasing from the Canadian Armed Forces because when they look at the prices online or looking to get a family doctor if they have a special needs medical situation, they know that they can't get a doctor and they can't find a place to live. So that's number one. Number two is we have active serving regular force members who are still coach surfing that were posted here in the summer. They cannot find a place to live. They're regularly now going to food banks. The Op Dasher program that Shelley talked about, I've sent more people there this year than I have in 38 years. People cannot afford to live here. They cannot secure housing. They cannot secure a rental. People are living, trying their best because they have no choice but to show up for work, as Shelley said. So they are living in Truro, in the Valley, towards Cape Breton. They're finding anything that they can that's affordable, but nothing is in the Halifax or the HRM area as a whole. Again, I mentioned the food banks. People are coming to work hungry. Young soldiers are coming to work hungry, and leaders are trying to feed them as best they can using their own money. I've personally had to give out 5 Christmas dinner boxes so far myself, again on top of the Op Dasher program, just looking because people are struggling just to put Christmas dinner on the table for their families. And just in closing, I would just like to say it's heartbreaking that these are the people, currently their primary job is to defend our country and they can't afford to live here. Thank you, Mr. Chair.
Thank you, Ms. Fleck. Thank you for your service. Mr. Hood, did you have any opening remarks you'd like to make?
Sure, I'll make a quick one.
Okay, Mr. Hood.
Ladies and gentlemen, people of the committee, I've served in the military for 33 and a half years. I just retired in September and rolled into this role as the Executive Director of Nova Scotia Nunavut Command of the Royal Canadian Legion. Royal Canadian Legion is committed to serving veterans and CAF members along with their families, and that includes the RCMP as well. The Legion often responds to the needs of veterans and their families through benevolence. And over the past couple of years, we've been seeing a rise in the use of our benevolent funds to a point where I'm starting to look at creative ways to obtain more benevolent funds to support those veterans. When I was appointed to speak here, I did a deep dive on this topic, and what I came across was some startling information of serving members of Canadian Armed Forces being posted here, living rough in tents, living out of their vehicles, couch surfing, engaging in interpersonal relationships for the purposes of securing housing, which often at times puts them as victims to domestic violence. And so this is quite a serious incident or epidemic, if you want to call it. And it needs to be tackled, and we need to look at ways to holistically come together in the various organizations that we all belong to come up with new and creative ways to support those who defend us. Thank you.
Thank you, Mr. Hood. Thank you for your service, and congratulations on your new role. So we will now enter into our question and answer period with questions put forward by our committee members to you. We will go in a 20-20-20 method here where each caucus will get 20 minutes to ask you questions. We'll keep track of it, but we have to stick to the time. So if you are in the middle of answering a question and I do call order, it's not that I'm being rude, it's just that we have to stay on the track of our getting equal representation for our caucuses here. So we will begin our question period now with the Liberal caucus. And again, just a reminder to please wait till you're recognized before you speak and the red light's on. We'll begin with the Liberal caucus. MLA Jessam.
Thank you, Mr. Chair. And if I may suggest my initial questions, I'd like responses posed directly to or from our team at the far right of the table, Ms. Hopkins, Ms. Fleck, and Mr. Hood. And then if our folks from the government departments want to weigh in on some of the things that they're doing, I'd appreciate kind of that primary and secondary commentary to respond. So we're approaching our third budget under the new government without an increase to income assistance rates. And I'm wondering if our folks from the MRFC, Ms. Fleck, we now have a vulnerable persons registry that's useful in terms of identifying people that are going through a difficult period. And Mr. Hood, could you weigh in on some of the conversations that you've been having with the people that you serve and how it relates specifically to the lack of increases from the income assistance program here in Nova Scotia?
So who would like to take a stab at that, starting out here? Okay. Ms. Fleck?
Thank you, MLA Jessam, through Mr. Chair. I would say it really has no impact. So the issue is that Canadian Forces members are over the threshold for income assistance, so they don't qualify. But again, as Ms. Hopkins said, when people come here, when they lose, most times they lose an entire income from, a working married couple. So they lose that income, and then again, all of the increased expenses, childcare, or again, if they have a child in university in another place, so they're paying those fees, living in another province, all of those family dynamics that come into play with a military family, but income assistance does not really apply or affect those.
MLA Jessam?
Okay, fair enough. I run into I guess a similar dynamic in the constituency I represent, where a number of households fall outside of that catchment for income assistance rates, and they run into situations where a family member loses a job and they still are kind of in a spot where they're making money, but they have lost that budgeted amount for the household, which can make it a challenge. So I guess I'll perhaps ask Mr. Hood to expand a little bit on some of the commentary he made with respect to serving military men and women, living rough, being forced into relationships or to maintain relationships because they have nowhere to go, and couch surfing. While I'm hearing that this doesn't necessarily land them in the income assistance program in terms of their ability to access that program. So how does what are they expected to do at this point, or what are they communicating are their greatest challenges to kind of getting beyond that situation?
Mr. Hood.
It is extremely challenging for them, and people are making very difficult choices right now. One is whether or not to continue pursuing a life in the Canadian Armed Forces because of the the challenges they face with the postings. I've talked to various serving members, both inside and outside of my military career. And with the personnel selection officers, for example, they are hearing from members that they do not want to be posted. They are settled where they're at. They don't want to leave because their spouse or their partners have good jobs where they're at. Their children are well embedded into their school systems. And so to come to a place where there is no easy way to find residents, and I can attest to that, being posted to Nova Scotia just over 2 years ago, the challenges that come with trying to secure housing here. So what I'm seeing is for a lot that do get themselves into homes is that we are supporting them with financial assistance, whether that be to top up their oil or help pay an electrical bill or whatever it is, just to get them from one paycheck to the next. And those are the best case scenarios.
Thank you. MLA Jessam.
And it sounds like you're in a situation where, I mean, I try to empathize with the situation. It's not me in those shoes, so I say this respectfully. It has to be difficult, not being able to budget for the household expenses and having to lean on whatever one-off supports may or may not be available at the time. And we've heard from other organizations that have come into this committee. For context, I've sat on this committee for 10 years now, and we hear about the challenges associated with respect to recruitment and retention in the Canadian Armed Forces, and hearing that folks are reluctant to move to Halifax in any context, but certainly in the context of joining our local complement of serving military. We're, if not the largest, amongst the largest cohorts in the nation. So that's difficult to hear. How significant is from a spousal employment perspective? How challenging is there? How many maybe examples of barriers with respect to credentialing or things that make it difficult for a spouse to move with the serving partner? How often do you see that come up, and what sorts of situations or perhaps professions do you run into there where that's most prevalent?
Ms. Hopkins, I believe you'd like to answer that.
Yes, I can answer that. What we see is oftentimes spouses are actually underemployed here in Nova Scotia. So as I said, 60% have post-secondary education. It depends on the job that they're needing, and then the job market that's available. So, administrative jobs, anything right now in healthcare that's in a support role, you're going to, they're going to be able to be employed in those. So, but it depends. It depends on the market. And then if you need to be employed because you need to be a second income family, which most Canadians do now, Canadian Armed Forces is the same, sometimes so those statistics are hard to say, like, what are the most jobs that they're accessing or the jobs that they're taking. They may not be taking them because that's their field of work. They might be taking them because that's what's available and we need a second income. And what we're noticing is that they are underemployed most of the time. Did that answer all of your questions?
Can I add something to that, Mr. Chair?
Ms. Fleck.
Thank you, Mr. Chair. To MLA Jessam, what I personally have seen is one of the biggest challenges is school teachers in Nova Scotia. So a lot of military members are married to school teachers. Years ago, it was an easy bounce from province to province that, everybody needed teachers and with experience. But in the last, I would say at least 10 years, coming to Nova Scotia, teachers of married to CAF members have not been able to secure a full-time teaching position, and they go on the wait list as, I don't know the right words for teachers, it's respite, it's substitute, sorry, that's the word I'm working for, thank you, and it takes them years. And by the time they roll into getting a job, then it's time to move again. And so again, they're taking much underpaid positions just to be able to keep the family afloat. Thank you.
Ms. Hopkins, you had your hand up.
I would also add with respects to recertification and accreditation, it's definitely a challenge. One of the things that we try to do is really reach the family before they relocate so that they can get those processes underway. So if you have to do a recertification or an accreditation, teachers isn't a great example, but that's an absolute challenge. The provincial barriers across the country when you're, you could be in the Air Force, for example, you're in the West, you're in the North, you're in the East, you're in Central, every 2 years you're posted, and so you're lagged behind even being able to work within your field because of the accreditation process. You might be a year into that posting and then leaving in another year to a year and a half, and you've just started to work because of the accreditation and recertification process. It's an absolute challenge and a barrier that we've been saying for years has to be addressed.
Thank you. MLA Jessen.
Thank you. Through the chair, I'd just like to pose this, ask Deputy MacKenzie and Mr. Eisan to weigh in on the work that they've been doing in collaboration with the Seamless Canada group and some of the, perhaps a similar request for information, the different professions that you run into that are coming up most often, and just generally speaking, some of the work that you've been undertaking more recently, please and thank you.
Deputy MacKenzie.
Thank you, Mr. Chair. Yes, the work with Seamless Canada Steering Committee is one of the functions that our department, under the leadership of Minister Adams, engages in with respect to attempting to assist and help navigate on this issue of spousal employment. And I'll defer to my colleague, Mr. Eisan, because he works quite closely, and I'm sure the committee might remember him from June 2023 to talk more about how Seamless Canada and our participation in it works.
Mr. Eisan.
Thanks, Deputy, and thanks, Mr. Jessen, for your question. As the Deputy pointed out, with respect to Seamless Canada, spousal employment is one of the 3 priority areas for the Seamless Canada Steering Committee. As I told the committee in June earlier this year, when we provided an update with respect to Seamless Canada and the work that has been ongoing, we have been actively involved with the Seamless Canada table, and certainly as it relates to the spousal employment file, we probably will continue that work between now and the next meeting of Seamless Canada, which is scheduled for the spring of 2024. The steering committee just met 2.5 weeks ago as well, received an update from officials with respect to the work, and as my deputy pointed out in her opening comments, we work very, very closely with the Department of Labour, Skills and Immigration on the Seamless Canada file.
Thank you. MLA Jessen.
Thank you. I guess I do want to state for the record, and I'll be requesting an update again this committee meeting. I've made several motions at this committee to try and expand the scope of our committee to include the work of Seamless Canada and that general effort. I don't think we've landed specifically on what the expansion would entail. The government has suggested that they are interested in doing so, but has yet to provide any sort of context as to how we bring that conversation more intentionally to this public forum. As I stated previously, I've been on the committee for 10 years as a former member of the government and working directly alongside Mr. Eisan at the inaugural Seamless Canada meeting. It's made a home for me. It's become a priority for me for the last several years, and I hope that this committee will make good on their commitment to take on a reinvigorated, updated mandate to enhance the work that we do as a provincial government, because a lot of the work that we do at this committee leans on our federal counterparts rather than, from my perspective, takes a proactive approach to how we use the provincial jurisdiction to support our serving and past military members. How are we doing for time? I think, do you want to jump in here at all? Yeah.
The Liberal Caucus has 5 minutes and 25 seconds. MLA Clark.
Thank you, Mr. Chair. And I just wanted to touch on a couple of things in the 5 minutes, 25 seconds that I have. There's an ongoing housing and homelessness crisis in the province and in the city. We've heard that in opening testimony a few weeks ago at Human Resources Committee, which I sat on at the time as well. We heard from the Affordable Housing Association of Nova Scotia that at that point in time there were just over 1,000, I think 1,068 people in HRM alone experiencing homelessness, and probably hundreds more outside of the city as well. And perhaps this would be a question for Deputy MacKinnon, I assume. Do we have any sense of how many of those people are either actively serving veterans or retired members of the armed forces? Do we have that data at all?
Deputy MacKinnon.
We were just discussing this, and maybe I'll defer to Ms. Fleck for this data, if you don't mind. We discussed it kind of prior to
Sure.
make sure you had that info.
Great.
Yeah.
Ms. Fleck.
Thank you, Mr. Chair. To MLA Clark, there are approximately 40 people that are considered unhoused veterans, or my apologies, but that number is not valid. So that is the, living rough, completely, without a home. There are hundreds, again, we were discussing this beforehand, that are, precariously housed. So whether that be couch surfing, again, forming a relationship to try to find a place, 6 people living in a 1-bedroom apartment, which is happening. There, we do not consider them, I say we as in the community, do not consider them to be, with stable housing.
MLA Clark.
Thank you, Mr. Chair. Thank you, Ms. Fleck. I appreciate that. And my assumption would be that, and this is true of all people, of course, but I think for serving members in particular, given the demands of the job, right, that are not the case for most jobs where you have to move around quite often and you're in and out of places much more often than other people would, you're at an increased risk of falling into these situations, especially when we're dealing with a housing market in HRM where the vacancy rate is 1%, if you're lucky. And in some places it's less than that, which is hard to believe, but it's true. And I know this is a big question, but what are the conversations or what are the steps we can take, particularly as it relates to veterans, to kind of turn that tide a little bit? Is there anything unique to the veteran experience that we might be able to use to help them, particularly beyond, of course, more housing, which is the panacea for everybody, but is there anything in particular that we can do for veterans in particular that would help them?
Ms. Fleck.
To MLA Clark through the chair. So I would, just off the top of my head, and I'm sure Ms. Hopkins may have more to add, but I would say, preferred housing, I'll call it. So, bumping them up on a wait list for, affordable housing. So giving them, preferential treatment, we'll say, when we know that they're coming to Nova Scotia, which, they get sometimes 6 months, sometimes 3 months notice, sometimes it's shorter, and they come here, they have 5 days to find a place to live. That's the maximum that they have. So when you arrive in a new place, you get 5 days to either buy, find a rental, whatever. So obviously it's very challenging. So if there were, and most people can't afford to buy a house here, and like you said, there's, the 1% rate is just out of their price range anyway. So to find, a long-term rental, so, minimum, 3-year lease, or it could be longer. But to be able to, work with the MFRC or different organizations to be able to, put them as a priority, which could be validated very easily when they get their posting message, that would certainly help a lot.
MLA Clark.
Thank you, Mr. Chair. And what kind of, as you say, 5 days is an incredibly short period of time to figure out where you're going to live, no matter what the situation. I'm wondering what is the general time frame, and I'm not sure who would know this answer. What is the general time frame between notification of a posting and then actually, being on the ground in a place? What kind of time frame are we looking at between those two? Yeah, okay.
Ms. Fleck with 30 seconds.
Okay, so very quickly, generally you get your message, so messages will start coming out in February, March, and then you need to be in place by July, August, and you have a 5-day window somewhere in there to book what's called your house hunting trip to come down and secure your living arrangements.
Thank you. So that concludes the first round for the Liberal caucus. We will now move to the NDP caucus. MLA Hansen.
Thank you, Mr. Chair. I'm very curious about a lot of things, but I'm also in a space where we need to be looking for solutions. And I know that everyone here is about helping and doing the work that needs to be done, but I just want to wrap my head around exactly how we can do that and how this is going to work for folks, especially our veterans who have served our country and have done, tremendous work to continue to keep us safe and free. So my question is for DCS. I just am curious to know, what role does DCS play with supporting military families and veterans? Because you mentioned there was a bit of programming that is able, so I'd like to know that.
So Deputy MacKinnon, will start with you, and if you feel you need to pass it on to anybody in your department, feel free. So Deputy MacKinnon.
Sure. Thank you, and this is very helpful for me, I will say, as a new deputy in the role, to hear some of these concerns as I kind of explore the art of the possible within the department. So it's not, as I said, part of our mandate necessarily, but certainly some of what Ms. Hopkins was speaking to in what the Military Family Resources centers play, we also can provide through our family resource centers. So some of the same supports anyone who goes into some of these centers, there are 26 of them across the province, can access those supports. And if I could, I would ask Tracy Embrett just to talk about some of that programming that's accessible.
Ms. Embrett.
Thank you. So child and family well-being prevention and early intervention programs are delivered in communities across Nova Scotia by community-based organizations who are well-positioned to build trusting relationships with youth, family, and other community members. Very much grassroots programming and community involvement.
Excuse me, Ms. Embrett.
Yep.
Can I please ask you to lean closer to the microphone?
Certainly.
Being told they're having a hard time hearing you a little bit, so thank you. I appreciate that.
Thank you.
Sorry to derail you, but go ahead.
No worries. I don't hear that very often. Okay. So the best way to protect children and youth and families, our mandate is under the Children and Family Services Act, which is risk of abuse or neglect for children. However, the prevention piece and early intervention piece is significant to mitigate any concerns with families. So we have continued to invest in community-based programs. As our deputy has just referenced, we have 26 family resource centers across the province and a number of other service providers who provide supports to anybody in community. It doesn't matter. They're not income tested. They're not means tested, needs tested. It's just whatever is available when a family comes to the attention of one of these community programs. They could be referred, thinking about how we could work with the Military Family Resource Center as if there is a location that is not close to where services are offered through. Our colleagues Family Resource Center. So some of the programs are Parenting Journey, which is a goal-based home visitation program for families experiencing complex social, emotional, and family challenges. So that is home visitors who go out to meet with families in their homes or in other locations to provide support they need to build skills and support networks based on their own goals, strengths, and priorities. We also have Strengthening Fathers programs, which has been previously known as men's intervention programs. Not a family-focused name. It really, Strengthening Fathers supports fathers who have used family violence or at risk of using family violence in their home. The program supports safety and well-being for fathers and their children partners and other family members, really looking at the strength of a family and trying to keep that family together. Obviously, when needed, we'll also make referrals to ensure children and spouses are kept safe. We also have Fatherhood Matters, which is another approach to dads, which is a parenting support. It's accessible, safe, and appropriate to the needs of challenges experienced by fathers, their children, and families. So services and supports that are unique to a community, unique to individual circumstances, and they include parenting support groups, interactive activities, workshops, drop-ins, one-on-one supports, and specific cultural supports as well. The family resource programs have a number of offerings to strengthen families. There's community, family, peer support. Throughout the province, we have cultural connections. We have 4 locations in Nova Scotia that focus on cultural connections. They're located in Kentville, HRM, New Glasgow, and Halifax. And what they do is they make sure if someone identifies as being Indigenous or of African descent, that even wherever their community is, wherever they're living, that there are appropriate cultural supports for them. So the Cultural Connections program will work with the community service providers in someone's town or area where they live and make sure that there's an appropriate lens put on the services and supports offered. We also fund and support youth outreach programs to support youth to achieve social, educational, economic, and health outcomes. Very important work. It's very holistic and focuses on healthy relationships, again, cultural and personal identity and community involvement as well. We have Youth Outreach Plus, which is specific to youth who are transitioning to adulthood, so that would be specific to children in care. And we also have programs like a Place to Belong, which is a program offered throughout Nova Scotia through the Family Resource Centers, and it's a positive environment for children and youth aged 5 to 18. To build relationships, learn how to build relationships, practice how to build relationships, experience cultural learnings and teachings, and to develop confidence and life skills. On top of our defined programs, we also support with needs that a lot of organizations do, oil, fuel, home heating bills, food security, diapers, formula, whatever a family may need. We will support that through our family resource centers.
Thank you. MLA Hanson.
Thank you, Mr. Chair. Thank you for that. I'm actually very well versed in programming. I did programming myself, so I'm really glad to hear that there is continual programming. My thought, though, about that is there sustainable funding for these parent resource centers that is not just year by year, and as well, is funding available or funds attached to some of those other programs where we know that the cost of living is high, there's a high cost in housing. Is there a way for some of those things, and I don't mean to say it like to put all of that work onto the resource centers, because we as a government have a responsibility, but I also want to know what could we be doing as a government to be able to make sure that folks, especially veterans in particular, are able to not have to access as much the food banks, or, I mean, I don't even know if they'll be able to have a housing outreach worker because they don't fall within the cost bracket, right? Like the, you know what I mean, the income bracket. So I say this because, it is available to those folks that need it, absolutely, as a parent resource center. But for those folks that make a certain income, what type of funding or availability is for them to be able to help them through the struggling times, help them through housing, help them through, the cost of living and food and such. So I'm just kind of curious to know, how do veterans fit under that bracket?
I'll direct that back to you again, Ms. Embrett, if you'd like. Ms. Embrett. Yeah.
I was going to say I gave it to Joy. Oh, over to you. No.
Okay. Oh, sorry.
The microphone came on. So.
Thank you. So with the Child and Family Wellbeing Program, the focus really is on children and families as a group, and how we can support the adults in a family to be strong and resilient with their children. I can't... Your question around housing support, these programs, and as you likely know, the parenting support programs do not support for finding housing, but definitely for the financial needs in real time. There has been an increase year over year in funding, a significant increase in prevention and early intervention in Nova Scotia. We recently, we just finished in 22-23 the implementation of an increase of $11 million. It was over 3 years in prevention and early intervention. And in the 23-24 budget, we also received a $7.8 million investment to enhance and expand programs. A big portion of that is for youth transitioning into adulthood, which would be, I guess, an indirect to the topic of discussion today, because it would require a child. This is focusing on children in care and children receiving youth services. Yeah.
Deputy MacKinnon, I believe you want to speak.
Just to add to that, I would say certainly anyone who would, one priority for us as a department is whoever comes into the department. We're often meeting them at their worst. At their worst moments. And we want to try to do as best we can to help navigate those supports. So our folks obviously have very close connections to housing support workers, and certainly direct connections to our colleagues at the city. So very helpful to kind of navigate those programs for members of the military, whoever comes into the system to help connect to those programs. I just wanted to mention that a couple of weeks ago, we were approved to roll out some additional food security funding that will go out in January and February, an additional $5 million, and some of that will go to family resource centers as well. And just with my in my previous role as Associate Deputy at Communities, Culture, Tourism, and Heritage, anytime I can plug some of their community food programs, because they're able to do some unique partnerships potentially with military families, community groups specifically serving them. So I think there's probably some takeaways in terms of the art of the possible there. They may have some projects underway already.
MLA Hanson.
Thank you, Mr. Chair. So another question that I have, because it was discussed earlier about housing is always a challenge, and we know that even just to relocate as a non-military, it's really such a challenge. So I'm curious to know if there are any thoughts, probably from this end of the table, on what we could be doing better, or if there's something that stands out that we could be utilizing as government to be able to help military families and veterans. Like, I'll use an example, Homes for Heroes. I mean, that was mentioned last year when I sat at this table, and yet there has been no talk about something where we're using specific funding for military families and veterans, because, this is a need and we know that it is. So I'm just curious to know if there's any solutions, any thoughts something that we could probably take back and apply it when we sit at some point.
I'm getting a lot of people looking at each other. I just need, a hand would be great to know. All right, pick one. Ms. Fleck.
Thank you, Mr. Chair. To MLA Hanson. So years ago, when I first joined the military, the biggest support was having military housing. So when you get to a new place and that military housing was available, not only was it, there's something there that you can rely on, but you also have that built-in sense of community. So military members, when you move around and you uproot your children and you're going to a new city, province, neighborhood, that is a huge stress relief that you can talk to your own kind, we'll say, that you can bond very quickly. The kids bond very quickly because you move around and you have that lived experience. Years ago, the government sold off, the federal government, through the whatever housing is called now.
Canadian Forces Housing.
Yeah, that one. CFHA, yeah. They sold off the majority of housing, so it's mainly all gone. So there are, 2 small spots left, a few in Shearwater and a few in Halifax, but completely different. The Halifax side is apartments, and the Shearwater side, is housing. But again, the wait lists are very long. People can't get to them. By the time, some of them, one becomes available for them, then it's time to move on. So that would be, the biggest recommendation I could ever make is more military housing for people coming here because it's stable, it's available, but again, it's that sense of community for people as well. Thank you.
Thank you. MLA Hanson.
Thank you, Mr. Chair. Okay, so staying on that note of military housing, how many, when we talked about recruitment and retention, ideally, is there a number that you would like to have recruited or should be recruited every year or that is needed here in our area? And are we filling that need? And if not, is it because of those factors?
Okay.
So Ms. Fleck.
So that's a very challenging question. I will say my last military role, one of them was in charge of attraction, retention, and recruiting for the 4 Atlantic provinces. So Canadian Forces overall, I believe right now we're short about 26,000 people. In the Army, sorry, I don't think that's including the Navy and the Air Force. So recruitment numbers are down. People don't want to move around anymore. Again, and we're losing. So from a retention standpoint, people are leaving earlier because they don't want to move as often, because they know places like, Nova Scotia, again, highest tax rate in Canada. Housing is unavailable. They can't afford to sell their house and then buy a new one. And there's just, again, the doctor shortage and access to health care, child care, it increases the stress level, which, if you have an operational stress injury, some people call it post-traumatic stress disorder. All of those factors, are exacerbated when you start moving people around. So it all comes together when, retention is an issue depending on where you're at, depending on where you're sending them to. Recruitment is another issue based on, it's Army, Navy, Air Force. The Navy goes East Coast, West Coast generally. The Army could be anywhere. The same with the Air Force. It tends to go all across Canada. So it's a large, I could sit here for 3 hours and answer your question, which would never fully get answered. It's ugly and complicated.
Mr. Hood, with about 2 minutes and 18 seconds, please.
I'll take 18. Looking at the housing situation with the personnel merit quarters here in Nova Scotia, the wait list that we're seeing is approximately 65 for the Halifax Shearwater area and 20 for the Greenwood area, and those are the 2 primary areas. So on its own, that doesn't sound like a big number, but it's a big number because that's overall 85 families that are waiting for accommodations. And that's to go back on what Ms. Fleck said, 25 years ago when CFHA took on the the housing for military, the Treasury Board mandated that the housing would be cut in half at least. And so what happened from that was, at that time, it made sense because the housing market was very good. It was very robust. In fact, more military members were living on the economy than in the PMQs. So when the number crunchers looked at it, they said, well, they're living on the economy. We don't need all these houses, so let's start cutting. But nobody saw, COVID. Nobody saw all the things that came up to this point that led us to the situation that we're in. And so the primal function of a Canadian Armed Force or any military force should be operational capability, the ability to basically pack up, move, and fight wherever they need to go at a moment's notice. And the military cannot be worried about where their family's going to be living and what they're going to be doing when they leave. And so there's your retention problem right there. When we have these questions, when there's more questions than answers, people will go elsewhere.
Thank you. 15 seconds, MLA Hanson.
Thank you, Mr. Chair. I just want to say thank you. I'm grateful to be the MLA of Halifax Needham, who has a large population of military families, and I understand what that means, and we have to do better.
Thank you. That concludes the NDP round of questioning. We'll now move to the PC Caucus for 20 minutes of questions, and I recognize MLA Craig.
Thank you very much, Mr. Chair, and that was for the caucus, not just for me. 20 minutes, correct?
Because I'll let you guys fight that out.
Well,
but,
I'm not going to.
MLA Craig.
Thank you so much for being here today. Thank you, Mr. Chair. Thank you very much for being here today. And Ms. Fleck, when you talked about sense of community, being brought up in a military family and moving from place to place, certainly there was that sense of community as dependents and as families. And when you got to move, you knew that likely you're going to find somebody that you've already been posted with, and that was good. That provided some sanity, at least for the kids. I can tell you that some kids thrived on that and blossomed, others not so much, as you know. And to hear you talk about the challenges today, and I know going back at that point in time when we lived in PMQs, and in the public, it was always different. It was always different for the military families, and unless you've experienced that, it's hard to explain that sense of camaraderie, that sense of belonging, regardless. So I want to thank you for your service here today. I want to thank you for your advocacy, providing information and support to the current and former serving members. I want to just comment a couple of things and then ask a few questions, if I might, so I don't have to arm wrestle these guys to my right here. We've got, so I lived in Wallace Heights, and it's no longer PMQs. Okay, Shannon Park, Wallace Heights disappeared. A lot of military families in the late 60s, early 70s built out in Sackville, Coharbert, Sackville in particular, one of the largest communities built in Nova Scotia and in Canada, of all Canada, and it basically was military driven. Sense of community moved from a base, PMQs, to a community. And to this day, we see that power out where we live. I've seen a number of my colleagues who would have been dependents, and now we have grandchildren, but our parents are in their 80s, 90s, and have had difficulty with pensions, having difficulty meeting the cost of living, own their own homes, find that they have to sell their homes, or the children take it, move in with children. My question is around this. So those veterans that are out there, what types of programs, information support, advocacy do you do with the different governments, whether it's provincial, federal, or municipal? And Ms. Hopkins, I'd probably direct this to you, Mr. Chair, if I might. So I've been to your center when I was a municipal councillor. I know the great work that's done. And thank you for that. Being a not-for-profit, an organization out there, to do this out of your hearts, really big hearts, to help those in need in this particular community. So how do you engage and advocate for veterans? And I just want to focus on veterans for a second. How do you advocate for veterans, and Mr. Hood, maybe you can comment on this too, as the Legion, with the various orders of government today to get some of the things, to get our other guests here to initiate things or to look at things perhaps in a priority was mentioned, either in a priority fashion or a completeness wraparound type of engagement?
Ms. Hopkins.
Wait for my red
Ms.
light.
Hopkins,
Okay.
there we go.
Well, you actually said that, wraparound service. That's one of the things that we try to do. So our goal is really to support the veteran family member. There's so many agencies for the veteran, so many agencies, one here at the table today. And one of the primary things that we do through the Veteran Family Program is we have a Veteran Family Program navigator, and she's aware of all of the resources in the community and across Nova Scotia. There's probably close to about 200 different types of agencies that support veterans, and relationships with our transition centers. So that is the military agency that makes sure that medically released veterans are transitioned with all the supports that they need for the release process. And now just newly in Halifax, they have launched just last year, the all veterans now go through the transition center so that everybody makes sure that they're aware of those supports. So we're connected with the transition center with having a staff member co-located within our MFRC and at the transition center, so that we make sure that when a veteran is releasing and coming through the transition center, which is a requirement, we're connecting with that family member to make sure that they're aware of the services of the MFRC and they're aware of different services in Nova Scotia. Sorry, what was the other part of your question? I'm so sorry.
MLA Craig.
So the support of the veterans is one thing, and the advocacy part with the different orders of government, whether it be municipal, provincial, or federal.
Ms. Hopkins.
Good. Sorry. So just in the last 2 months, we've met with the Minister of Veterans Affairs and we met with the Ombudsman for Veterans Affairs. So it is about very much staying connected and making sure people are aware of the veteran family experience. One of the greatest challenges that we have at the Military Family Resource Center, and a big perception of everyone across the country, is that we have access to military and veteran families. That obviously Military Family Resource Centers would get a list of every family that's posted, would get a list of every family member that's in the Canadian Armed Forces, and would get a list of everybody who's deployed and when they're deployed. That is not the case. We are an optional service, so we are funded to provide a mandated service to military families and to veteran families, but we don't know who they are or where they are unless we can connect with them directly to have them fill out family contact information, and then we can get to them. So it is imperative that we are connected with every agency we possibly can to make sure that they know about the Military Family Resource Center, so they can also refer back to us if a veteran family or military family comes into one of their agencies or accesses one of their resources. Because the Military Family Resource Center, they spoke about the Family Resource Center programs, and yes, and those are great, and we have some partnerships with other ones in the community, Sackville being one example, and even in the Truro community, there's a Family Resource Center there we're connected with, and they do serve those families in those communities. But there are some services specifically that the Military Family Resource Center has available to any family, regardless of where they're living in Nova Scotia, that another Family Resource Center just wouldn't have those particular services, because again, we see things through the lens of relocation, absences, and transitions, and our resources directly support those things. So for us, it's crucial to constantly be doing education advocacy at the government level, at the community level, even with families themselves, to help them understand that they can access these services, what services are available to them, and then the different ways that they can do that, but that they need to connect with us, or the member is always the gatekeeper for us, so we're constantly trying to find ways to get to the member, to educate and get access to the family.
Thank you. I believe Mr. Hood would like to respond as well.
If that's okay. So Royal Canadian Legion operates on multiple tiers. We've got Royal Canadian Legion Dominion Command, who operates out of Ottawa, and they advocate for veterans on a national and federal level. And then beneath that, you have your command at a provincial level. For us, it's provincial and territorial, as we also hold a couple branches in Nunavut. So here in Nova Scotia, we have 100 Legion branches across the province and roughly just over 16,000 members. And so with that, we have the outreach to the communities to reach out to veterans to provide more intimate care, whether it's Meals on Wheels programs or whatever, to help address immediate or personal needs, to grander scale veteran outreach programs, which introduce or bring back purpose, what I call service after service, to re-engage veterans and get them involved in community activities. There's going to be more coming on that. From the veteran homelessness perspective, we do have a benevolent fund that's partially funded through the Poppy Trust Fund, but also comes from external donations, and we use that to support our veterans in more immediate ways. As I mentioned before, that could come in the ways of providing I've sent several fuel trucks out over the past month and a half to veterans' homes to top up their oil, to make sure they're good for Christmas. I've actually got an elderly lady, the widow of a veteran, who I'll be dropping a turkey off at probably on Thursday. And that's just the kind of stuff that we do on a very low scale level. And the big thing is bringing dignity back into their lives, because when we all served, we served a very high purpose. So when we leave that high purpose and enter the private life, it can be difficult to find our footing, and it can be very difficult to find purpose again. So our objectives are to help find that purpose again.
Thank you, Mr. Hood. MLA Craig.
Thank you, Mr. Chair, and thank you for those responses. When, Ms. Hopkins, when you said that people would generally think that you had all the contact information and you had that, and when you said you didn't, that really caught me by surprise. So thank you for that. I think it's a lesson for all of us to know that we have to engage with you versus the other way around. You've got some abilities there and capabilities to do certain things. However, if you don't know there's a problem, you don't know there's a problem. Right? So I think that's a lesson for all of us, is to certainly engage at whether it's municipal, and I know Ms. Fleck will do that for sure, but and I know our own province will do that as well. Mr. Hood, you talked about the transition. You've recently gone through the transition. I know my father went through the transition. I've seen many, many members go from the transition of something that was sort of chain of command, supported. I'm not going to get into salaries, and especially at the lower ranks and the suitability of that. That's a whole different discussion for a whole different area. But that transition, all right, so in the process, I'm not talking about necessarily medical release, but you've done your 30 some odd years, and you are now going to transition. You've got your family who's used to the military life. You've got yourselves that are used to the military life. What sort of transition plan is available to those who are moving into either full retirement, which a military member doesn't usually do? They either go into another employment or they go into a volunteer capacity, all right, because you like that structure, in my experience anyway. Maybe it's not everybody, but so what types of programs are out there that you're aware, and that perhaps if they're not existing, what, again, I'm going to come back to advocacy time and time and time again, okay, so because advocacy with orders of government is so important in everything we do, and also with the employer. So the Canadian Armed Forces, the employer, doesn't matter which branch you're in, Navy, Army, Air Force. But so what role do you see your organizations playing in helping in transition, or is that more of an informal role that you might have and you're sort of, yeah, okay, or is it more formalized in that you have contacts, you have context as well to help with who's ever in charge of that release to make things happen? I would, Mr. Chair, probably all three would like to answer that. I don't know.
Okay. All right, we'll begin with Mr. Hood, and then we'll go from there.
So what was already mentioned is the transition center. That transition center's primal function is ensuring that military members transition effectively into veteran life. And there's a whole bunch of programs and steps, scan seminars, and career workshops and things that go on, and through VAC there is re-education funding that if somebody wants to engage in a new career after life of service, then they have those opportunities. And that's at the grander scale. The Royal Canadian Legion has always existed, well, since 1926, to serve as a safe haven for veterans to help regain their footing after service. And what I'm seeing as a fairly contemporary veteran is that there's a growing desire for veterans to continue to serve in some different capacity, and we're seeing that from the different types of organizations that are rising out there, like Team Rubicon and other organizations that take advantage of the skill sets that veterans have to repurpose them in a way and give meaning back to their life. And I can say from a personal note, falling into this role as executive director for the Royal Canadian Legion has given me personally that sense of service after service and a sense of purpose moving forward to help my fellow veterans move forward themselves. So that's what we need to look at, is ways to engage the veterans community to get them, honing in and capitalizing on those skill sets that we all have.
Ms. Fleck, did you want to respond?
Thank you, Mr. Chair. To MLA Craig, this is a fantastic question, so thank you for asking it. It's transitioning is the hardest thing that people will ever go through. I always say I gave up my security blanket, and it's really hard because it's the only thing most people know when you fresh out of high school, and then I go to university. The military sends me there. They teach me how to speak terrible French and everything else, and then that's the only thing you've done for your entire adult life, and then it's one day it just stops. So all the supports that go with that. The biggest challenge, and I don't want to reiterate, but I will say that Veterans Affairs Canada and the Transition Centre, other federal programs, and that the CAF has done, truly have really stepped up the game finally after decades of being ignored. So they really have truly improve the systems that are now available. The biggest issue, though, is that people move back home, wherever that may be, generally after final retirement, and then so they're trying to find that community again, and as Mr. Hood said, trying to find that sense of purpose. So again, they generally reach out, to their peers and friends across, that you made over the years and say, hey, okay, what do I do now? So again, Team Rubicon was mentioned. So we had a lot of people with the floods, the fires and the flood 1 and flood 2. We had Team Rubicon here helping, for example, and they picked up all kinds of new members because people were saying, hey, this is really cool. And again, that sense of purpose. So they need to find that in the community that they've now settled in, which again is starting all over a new life, because you're now retired, you're moving back to wherever, may not be home, it may be just somebody or somewhere that you live that you fell in love with, but again, it's starting over.
Ms. Hopkins?
I think I'll just take a little bit of a different turn on that rather than repeating what my great colleagues have said here. Because we're in the business of navigating families through systems, one of the things that I think, when you talked about solution focused, for us is we are uniquely positioned to hear family stories, but also hear about the gaps in those systems. And so sometimes it's not about more, it's about different. It's that there's so many services that exist, but we're often working in silos in those services. There's not enough overlap. There's not a wraparound service around the family and around the member. You know, you think about the homeless veteran experience, you know, when there's a release process, well, there's a lot more that, you know, the root cause of homelessness, right? Where's the wraparound service? Like, what did we miss? What did we not look at in terms of making sure that when they transitioned out that they were going to have success not only with housing, but in all of the other areas that they needed that. So definitely, I agree, the transition center and the future trajectory of the next 10 years and what they're planning, I think will make some really great impacts. But there's a lot of services, but often we don't know about them. We lean a lot on the Legion for a variety of different things. They're benevolent funds, you know, that Craig has mentioned a number of times today, but a lot of other great work that the Legions do, but people have no idea. So I think there's really taking a look at, there's no central place of people understanding what are the vast ranges of services available to veterans, and right now the MFRC seems to be filling that gap in terms of centralizing services through our navigation support with our veteran family program. They're the person who knows, you know, all the different services in the community, what types of funding families can tap into, but sometimes there's so much. It's not about doing more, it's can we just do different? Can we not work in silos?
Thank you. MLA Craig, you have 2 minutes and 10 seconds.
Me or the caucus?
Your caucus has 2 minutes and 5
Mr. Chair,
seconds
I'll
now.
yield to one of my colleagues so I don't get throttled after this meeting.
MLA Harrison.
Thank you, Mr. Chair. You know, when I sit on committees like this, I'm always impressed with the caliber of the people that are involved with the programs. And this committee is just, I'm always impressed, 100%, with the people that come in and talk about the job they're doing. So many challenges out there for everybody, and certainly for our veterans and their families. And look, I'm extremely impressed with what you folks offer to trying to get those problems solved and those challenges met. So thank you very much for that. Just have, probably going to get one question in anyway. To Ms. MacKenzie. I know, it's time, isn't it? How does your agency engage with and respond to the needs of veterans and their families in Nova Scotia?
Deputy MacKenzie with a minute to go.
Thank you, Mr. Chair. Thank you for the question. It is a great, it's with a great deal of pride and commitment that Mr. Eisan's team connects with military families, and Minister Adams as well, who takes her work in terms of connecting and highlighting the role of military families in the province very seriously. She appears at countless events, not just to appear, but to actually make connections that on the ground can actually result in information flowing to people who are in those communities, so that we can do the connecting of the dots that it is incumbent on us to do as government. And it is challenging because despite the federal government having full legislative and policy control over military matters and its affairs, we recognize the importance of that collaboration to connect those dots.
Order. Sorry, the time for our questioning for the PC caucus has been completed. There will be another round, a smaller, shorter round. If you'd like to maybe the caucus finish that after the next round, feel free to do that. MLA Jessam, we will give everybody 7 minutes to go around each caucus, and then we'll end with closing statements. So, MLA Jessam.
Thank you, Mr. Chair. Ms. Hopkins referenced the intention and importance of adding to the research that's out there with respect to military families. And I'm wondering, pose a question to our friends in the government, are there programs, some of which have been referenced today, that have, a box to check or an identifier, like, for example, you see applications where an applicant is asked to identify as racially diverse or persons with disability. Are there any programs that fall under your roofs that would have that identifier checkbox as, whether it's military or a veteran? Through the chair, please.
Deputy MacKinnon.
No, not necessarily under community services, although, as I said, if there was, if someone kind of volunteered that they were a member of a military family or a veteran, then we can help connect them to those programs. I'm certainly willing to, as a takeaway, have get a better understanding across government of what those programs might be. Though I'm sure there are some. And Ms. Fleck or anyone, please chime in. But I'm really happy to. That's a good takeaway for me to check in with my colleagues.
MLA Jessamine?
Thank you, and likewise to Ms. Fleck. Does the Vulnerable Persons Registry at HRM have an identifier as a part of that program?
Ms. Fleck?
Thank you, MLA Jessamine, through the chair. So, now that no, the answer is no, we don't. But now I need to relook at why we didn't, which is ironic coming from me. But took your point. I just whispered to Ms. Hopkins that, why aren't we, like the federal government does for public service jobs, why aren't we asking for that box check from the province and from the municipality, for priority hires for veterans and military spouses? I think is a fantastic takeaway. Thank you.
MLA Jessamine.
Thank you. A question for Deputy MacKenzie, Mr. Eisan. Have you had specific, you referenced the work that you're doing with respect to spousal employment and kind of operating through a relationship with labor skills and immigration. Have you had any specific correspondence or asks or interactions with any or a few credentialing bodies, regulatory bodies, teachers college? I think we referenced teaching as a profession here that has trouble landing the plane when they show up. So can you report for the benefit of the committee to any of the correspondence or work that you have done specific to interactions with these self-regulated professions or credentialing bodies here in Nova Scotia?
Ms. Deputy MacKenzie with 3.5 minutes.
I'll try not to take too long again.
Sorry.
Let me begin. Thank you, Mr. Chair, and thank you for the question. With respect to the credentialing question, it is something that hasn't been specifically raised with respect to military families or veterans. I do know that there used to be, and it's a good takeaway for us on the issue of checking the box, because historically the Civil Service Act and the General Civil Service Regulations had some provision related to identifying prior military service, which to my knowledge hasn't been changed, but we can check on that. With respect to specific questions with specific professions like teachers or the ones that were spoken about today, I'm sure people are aware of the recent initiatives to ensure that the supply of teachers is made more consistent with respect to the expedited credentialing and the programming through CBU and those types of things. So the general approach to dealing with the issues in the population are there, but with respect to dealing with those discrete issues that may arise within the community of military spouses or veterans, those are things that would, I think, transact on a more personal basis and or a more kind of one-off basis. And with respect to the connectivity that we try to do at Intergovernmental Affairs through our work under military relations, my colleague, Mr. Eisan, through his connections with the Department of National Defense and Canadian Armed Forces, would be trying to make people, to connect people in those ways so that those types of unique issues that are unique to an individual could be addressed through those types of connects that we're trying to do, whether it's through the Register of Teachers' credentials and that type of thing. I'll hand the microphone to him if there's any time left on the 3 minutes to talk about how some of those connects happen through the work that we're doing with LSI with respect to Seamless.
Mr. Eisan, the deputy's left you 1 minute and 10 seconds.
So what I would say in follow-up to my deputy's comments is the good thing about the seamless table is that it is an organic table, so it doesn't prevent provinces or territories from bringing issues to the table when issues come about. And I know from our work with the seamless table, they are constantly engaging with military families to find out what are the key issues that military families are experiencing. And so once those issues are brought to the table, those are discussed, as you know from your experience when you went to meetings in the past. So we will certainly take those, and we work across government as a central agency in intergovernmental affairs, and we work across government and to deal with our colleagues and address those issues and see what can be done to obviously to work with to go back to seamless and work with them. You know, certainly we are engaged with them on a regular basis. More so, and certainly when we work across government, not only in our own government but also.
Order. That concludes this round for the Liberals. We'll now move on to MLA Hanson. 7 minutes.
Thank you, Mr. Chair, and it's going to tie into, so you just take a breather, you'll be fine. It's going to tie into, because we also mentioned that Veterans Affairs falls under our federal counterparts, and so we understand that, but we know provincially we also have a responsibility for those folks that are in need, which is our veterans. And so you were mentioning that issues are discussed across the table at the seamless table, but I'm just curious, you know, like, and MLA Craig had mentioned, advocacy is key, right? Like, we need to make sure that they are a priority, that they're on a list to say these are some major issues that we're experiencing in our province when it comes to housing, when it comes to employment, when it comes to healthcare and all of the other pieces. I just would like to know a lot more about like how that process goes.
Mr. Eisan.
Just as a point of clarification, member, process at the seamless table? Oh, okay. Well, you know, it's a federal provincial table, and you have two co-chairs, a federal co-chair and a provincial co-chair, and certainly we're represented at the steering committee level by Minister Adams, who's the minister responsible for military relations, and the seamless table meets twice a year. We just met in early December. It was a virtual meeting, and we will meet again in the spring, and that will be an in-person meeting. The meeting earlier this year was in Gagetown, I think the 25th of May, and it actually coincided with my appearance here at this committee on the 22nd of June to provide the committee with an update in terms of the work that we've been doing. So we'll, between now and May, between the next in-person meeting, we will have regular interactions, obviously bilateral, just simply with our seamless colleagues in Ottawa at the Department of National Defence, or we'll certainly have discussions across Canada as well with our PT colleagues as well. So as I referenced, if there are issues that are brought to us, generally, you know, that's the way, if the issues are brought to us, we'll discuss internally and certainly consult across government to see what we can do to sort of address those issues. Is that fine? Okay.
MLA Hanson.
Thank you, Mr. Chair. So I'm glad to hear that, because that's how, you know, things, communicating with each other about what's happening and being able to have a good relationship, a working relationship, to know exactly how we can move forward to helping folks with these issues. So I say this because I think I just want to know, are there any action items that you guys end up taking from that to work on within your own province to do that work?
Mr. Eisan.
Good question, good follow-up. And so I referenced spousal employment earlier. That's been one of the pillars of the seamless table. Certainly healthcare is a pillar of the seamless table. Education is a pillar of the seamless table. And from that is that there are a number of issues that spring up. So for instance, when we met earlier this month, there was a few issues with respect to education that we were asked to look into. We are doing that now. And it's my understanding that from the Seamless Canada folks in Ottawa who you know, when they're working with the provinces and territories, what they do is that they're constantly canvassing military families to see what are the issues that they have. And so many of the issues that have been discussed here today are issues that we're hearing about at that table.
MLA Hanson. 3 minutes and 8 seconds.
All right, good. Thank you so much for that. I really appreciate it. I was unaware. I mean, I know MLA Jessom has been very well versed in this, and I had the honor to sit at this table a year ago, and then things changed. But I'm glad to be here today to hear from folks and just to kind of get an understanding of what's being done, how we can be moving forward, and as well, you know, like what are some things as Mrs. Hopkins had said, you know. There are folks that are in silos, and how can we do things better to work with each other in order for us to, you know, move the pendulum a bit so that folks can access the services that they need. And as a government, I think it's really beneficial for us to know where do we direct, you know, our efforts? How do we direct these things when it comes to funding, when it comes to programming, when it comes to the work that is happening on the ground that we need to target to make sure that there is going to be some movement in some way in whatever department that comes from. So I say that with probably a minute or so left, but I don't really want to extend any time. I don't need any questions answered. I just want to say thank you very much for all the work that you do in and out of your office, but as well the advocacy work that you do for folks in the work that you're in right now. I know it's a difficult time for a lot of folks. Challenges are everywhere, no matter what that looks like, but we really do appreciate that, you know, you're on the ground, you're doing the work, and you're helping folks through whatever challenges that may be needed, but as well, you're making people feel a little bit better in this world that we're in right now. So I just want to say thank you, and we can continue on with the questioning.
So you're deferring your time to the...
I'm deferring my time.
Okay, so the PC Caucus, you have 8 minutes and 20 seconds. MLA Taggart.
Thank you, Chair. So I've, during these question and answers, I've sat here, and I'll be honest, I started out a little bit cranky. So I started making some notes because I sure don't want to, I want to choose my words so wisely here, but I think it's a really important point, and at the end I'll have a question to get your folks' view, I guess, or opinion, if maybe you're not allowed to give opinions. But anyway, so I really need to choose my words wisely because I don't, again, yeah, so I have the utmost respect, and I have many friends, mostly Navy, and mostly recently retired, that are, because of the age, you know what I mean, that are in the Canadian military. And I also recognize the great economic impact that the military has on the province of Nova Scotia with, you know, with our different military bases, predominantly the East Coast Navy and that sort of thing. So it's very, very, very important. And I believe, and I need to say this up front, that I believe that those residents that are active duty members and family members deserve access to the great social safety net programs that we have here in Nova Scotia. And these programs are stretched, like everything today. And they are typically targeted based on income. And for me, it is an absolute embarrassment that we have actually active duty military personnel, arguably some of the very most important federal government employees there are. And they are so poorly compensated that they must have social safety nets. That is unbelievable in today's, and I guess that during the discussions, you know, as you talked about, you know, why they sold off the housing and that over time and all that, but, you know, I can see how it got there. And I have to wonder what other federal government employee actually receives that little bit of compensation that they have to use social safety nets. You know, I would expect there's not very many. And again, this is the point that I really have to make here, you know. And so it's absolutely no wonder that, you know, that they can't recruit anymore. I understand it fully, and again, I think that it's shameful. So, but this is a Veterans Affairs Committee, And as such, we should be speaking about the veterans, and that's what had me kind of cranky in the beginning, okay? Because I really am passionate about the veterans. I'm a member of the Legion. I have a lot of friends, and I don't want to expound here too much, but I think about the veterans that were from World War I and II that as a kid I saw in our community and recognize now the challenges that they had with PTSD, and we never even knew it. We never recognized it. I feel bad about, anyway, sorry. So I'm passionate. So last month we had what I believe was the most impactful meeting since we started, and we had volunteer groups in here from different organizations that volunteers that were trying to support veterans that struggle with PTSD on the, and mental health challenges. And here we are today spending most of our time talking about active duty again. So most, of the most critical employees, I know I'm repeating myself, but I really want you guys to, I want your thoughts on that. And, I guess the one point I want to make, I guess what I'll put a question at the end here is, so much was said here today, and I understand the purpose, but much was said here today about all the reasons why active duty members wouldn't want to come to Nova Scotia, okay? Cost of housing, challenge with health care. So I guess my question, but I'd love to have your opinion as well, and that's the three at the end of the table. Are they really any different in Vancouver or Cold Lake or Petawawa or any of those places? Are our challenges here any different than they are? Are these people faced with these people? That's not the right word, okay? These active duty members, okay, faced with these challenges across Canada, and that's the biggest challenge here. Thank you. And so please give your opinion if you don't mind.
Mr. Hood.
The answer to your question is no. It is the same issue across the country, from British Columbia to Newfoundland and everywhere in between and everywhere above. This is the issue that Canadian military members are facing everywhere, and these are the issues that Canadian veterans are facing everywhere.
MLA Taggart?
Nobody else wants to respond to that? Okay, yeah, sorry.
Ms. Fleck.
Thank you, MLA Taggart, for the questions for Mr. Chair. So again, as Mr. Hood said, I don't want to have to repeat it, but on the operational stress injury, or the PTSD, some people call it, there are great supports. Personally, I've struggled, and the military and VAC and peer groups. So there are a lot of organizations out there, and they provide amazing support if you're willing to ask for help, which is the biggest challenge for our people.
Thank you. MLA Taggart. Sorry, Ms. Hopkins.
The only thing I would add is I would agree every military family, veteran family is facing the same challenges across the country. I think what's unique is that we've asked them to go across the country. And so they're without family. They're without their own social safety nets. And that's why they're relying on the community social safety nets, is because they're often now living in places where they've moved from family members over the years and have settled across the country. And so that family unit, that other people that, if you choose to grow up and stay in your community and, put down your roots in your community, military families don't often have those same options. Often we see veterans, particularly in Cape Breton, because we also service the Cape Breton area. A lot of them come home to, their original communities. But that's a disruption in a lot of their personal supports that, were not built in the same way that other Canadian families were able to build those networks when they've spent their whole lives in that one community. So I would say that's a distinct difference. But yeah, the experience is the same, I think, across the country for all veteran and military families.
MLA Taggart, just a minute to go.
A minute through. I talked to. So anyway, so listen. I don't want to leave the impression. I absolutely. I believe that the people that employ them have to do a much better job, without question. And but if I could, I'd like a quick question to Mrs. Fleck. Yep. When you talked about great supports, were they while still active or after? Because I've under the view that they're not quite as good after you get out, after you're released. Is that correct?
Ms. Fleck.
Thank you, MLA Taggart, through Mr. Chair. So both. I will say again that the federal government, VAC in particular, has again increased the supports to veterans, and especially at the operational stress injury level, and the supports that continue to be available. The major issue, and Mr. Hood would know this, is the diagnosis before you leave the military. So that is always the biggest challenge.
Unfortunately, that concludes the questioning period of our committee meeting today with our witnesses. Before you leave, if there's anybody who would like to give a brief closing statement to address our committee one more time, we'll begin with just show of hands, but I'll begin with Ms. Fleck.
Thank you much. Thank you very much, Mr. Chair. Sorry. Yeah. Lack of sleep is kicking in now. So I just want to say, Mr. Chair, to all members of the committee, thank you very much for the invite. I'm very proud, obviously, as a veteran and married to one, gave birth to some, all of the above. What I would say is, on the homelessness issue, and particularly, I call it the 3 helmets, not the 3 buckets. Obviously, from my Army background, and it's the first helmet full is those who kind of fell through the cracks long ago, and we're still, and it's very complicated and ugly to try and help a homeless veteran, because it's not just finding them a place to live. It is going through trying to get them hooked up at the Legion to do their VAC paperwork, to get them in the system if they haven't filed an income tax return because they've been homeless, trying to work with them, get them caseworkers, assisting with, again, income tax returns, working with DCS, can they go on IA, like all of these steps. It's not just, bring them in, they want to be helped. Sometimes it takes 8 to 9 months to sort through just for one person. And then some people get all the way there and they don't want to be housed. I'll be honest. I've had a lot of success with the people at this table, in particular to Miss Knight, who has been, her and her team have been amazing that, hey, I have a person, I need them housed now. And it has always happened. So somewhere there's magical powder in the background that makes it work. But that second helmet is, what we're dealing with now, and it's the current crisis. It's the current, no housing, no, leases not available, rent caps, all of those things, and just the general cost of living coupled with everything else. And then the third helmet is, what does next year look like? And that is what terrifies me, that we don't know. And we don't know how we can help. I'm out on the street in my kind of spare time, working with the ones that I do know. And again, it's just because, I have a relationship with them, and we'll continue to push them to the Legion. I use MFRC services all the time, and I call Miss Knight a lot to say, hey, I need help. So thank you very much, Mr. Chair.
Thank you. We do have some committee business to attend to, so I would ask any of our closing statements to be fairly brief if we could. Mr. Hood.
So right now, the Royal Canadian Legion is dealing with roughly 400 VAC cases, and that's what we're dealing with in assisting veterans get all the care that they deserve through Veterans Affairs. On top of that, we have our veteran outreach programs that help and assist in bringing that dignity back to the veterans through a variety of activities, as simple as getting together for a coffee to more extensive programs. And moving forward, as the new executive director here, I will be looking at forging new relationships with the various departments to develop ways, I hope, that are more efficient so that we can use our resources more efficiently and effectively to get effective care to those veterans and their families, and not rinse and repeat a lot of the resources. So that'll be my goal, and I know in meeting with some of my colleagues here today that they share the same objectives. Thank you.
Thank you. Anyone else for closing statements? Okay. So thank you so much. As an MLA who represents the proud community of CFB Greenwood, I do work with MFRCs and everything as well there. So we understand the great work that everyone is doing. So thanks for this conversation today. We're going to take a 3-minute recess to allow our guests to leave, and then we'll come back to our committee business. order. I will ask our committee members to come back to their chairs. And as our guests leave the room, we will continue with our committee business. The first item of business is a discussion around the letter to the Minister of Veterans Affairs Canada about the administrative and funding challenges faced by peer support organizations. This letter was distributed to the clerk, or by the clerk, to our members. Was the final change made? Is there any discussion on the letter that we will be sending? See no discussion. That's done. Thank you very much. The next item of business was an initiative brought by MLA Ince at the last meeting and discussing a process of writing to other provinces regarding the creation of Veterans Affairs committees in their provinces, and that was considered in the last meeting. So there were 3 options put forward by the clerk for the committee to discuss. The first one, contact the clerks of committees in other provinces to ask how they address issues or legislation on veterans. The second was providing the clerks of committees in other provinces with information about our Nova Scotia Veterans Affairs Committee along with our annual report to them. And the third option would be to reach out to the speakers of other provinces about starting their own Veterans Affairs Committee. So with those options about the committee reaching out and sending something out, is there any discussion on that? MLA Jessom.
I'm in favor of options 1 and 2.
Any other discussion on that? So we have general agreement around the table. The clerk will be instructed to pursue options 1 and 2, and then that will be that. All right, very good. Is there any other business? MLA Jessom.
In response to some of the I guess the positive feedback we got from a couple government reps about I guess a takeaway around an identifier, an optional identifier for government applications for folks to identify as a serving member of the CAF or a veteran, make a motion that our committee directs the chair to write to executive council members recommending the use of an option on departmental applications for applicants to identify as a member of the Canadian Armed Forces or a veteran.
So just a quick question. Are you asking the committee to possibly consider a letter from the chair directing them or asking, or notifying them of what we heard in the meeting today?
I think that my motion's to make a recommendation. We can't force ministers to do anything, but I think that it in keeping with the spirit of adding to the information that's available with respect to serving men and women, Ms. Hopkins relayed the value that they place in trying to establish more research and support that work. I suggest that this committee, it would be a natural recommendations from the committee to make a recommendation to ministers that would support the research that is out there for our serving men and women. So I'm comfortable making a recommendation. Whether ministers are comfortable with it or not, that's up to them. But I think as a Veterans Affairs Committee, I think that it's our job to advocate for veterans.
Thank you. Is there any discussion on MLA Jessom's motion? MLA Taggart.
Well, I have to apologize because I may have been right and I only caught part of that discussion. But are we first off, are we talking about veterans here, or are we talking about veterans and active service members? And the other thing is that I got to give it. I'm not ready to vote for that yet. I got to give that some thought. I just, everything we do has implications or unintended consequences, and I'm again not ready to. I think I've said this before. I'm not prepared to vote, and I will vote against any motion that I don't fully understand. Thank you.
MLA Hanson.
Thank you, Mr. Chair. I also want to make a note to the fact that the Deputy Minister mentioned that that might be something that the Public Service Commission already has, but they haven't quite enacted it in the way that I think MLA Jessom is speaking to. So it's just to confirm and just to kind of reiterate the fact that we want to make sure that we have, and was spoken today about priorities of our military members, and so that they are, so that we can, treat them with dignity in a way that we know that they are a priority. So I agree with MLA Jessom's motion put forward. I will be supporting it, but I will say that it's essentially identifiers so that we actually have the information and the data to do the work that we do.
Yes, MLA Jessom.
I just quickly clarify that the motion would be for serving members of the Canadian Armed Forces as well as veterans. So it would include both those, just for clarification. And I would also add that I recognize that we're not in a decision-making role on behalf of ministers. So this is a simple offer of to express through the discussion that we've had today what I believe to be a reasonable step in helping support the cause of increasing the information that we have about our serving men and women.
Is there any other discussion? MLA Craig.
Thank you, Mr. Chair, and thank you, MLA Jessom. I believe what I heard is that the staff will bring back, and they're going to look at it and so on. So I would be surprised if they did not have communication with the clerk just to sort of close that loop on what's happening, and that a motion is not appropriate at this time in my mind, and that to tie up other resources and ministerial cabinet and all of that when it's being actioned, in my mind, that's what I think I heard, is unnecessary. So I would not support that at this time, and I'd look forward to getting the information back through the clerk that something is being done.
Okay, I saw Emily Hanson's hand first.
Be long. Thank you, Mr. Chair.
Oh, that's the second time.
My goodness. Sorry, it's getting late. Goodness, I apologize. Thank you, Mr. Chair. I do want to say that, we've heard here today that sometimes things get missed, and when we talk about departments and sometimes not having those conversations within each other, I think it's just a reminder, maybe just to recognizing the fact that these are the things that we should be looking at, and this is why we meet in committees to gather information to be able to help the work that we do in government. So I just wanted to point that out. Thank you.
MLA Jessom, you had your hand up?
Yes, sir. Thank you, Mr. Chair. I just note that while I expect there will be some follow-up with the department representatives that were here today, the intention behind the motion would be to make the recommendation to the entirety of the Executive Council. And frankly, they could respond to it. They could do nothing with it. There doesn't seem to be if they so choose, there's really not a lot that's incumbent on ministers to do anything. It's a simple show from this committee that we believe that this is a reasonable step forward. There are other identifiers, optional identifiers that pop up on most, if not all, government applications, and just seems like a reasonable idea in the spirit of adding to the research that's out there for military members and veterans.
Emily Taggart, did you have your hand up?
I did. Anyway, the deputy ministers were here. They saw it. They heard what we had to say. Let's see what comes from that, okay?
Order. That concludes our meeting for this afternoon. Our next meeting will, please read the next meeting information. Oh, there it is. The next meeting is, sorry, I have to read just not your part. Yeah. The next meeting will be January 16th, 2024, and our topic will be True Patriot Love Veterans Virtual Hub Veteran Volunteerism. And our witnesses will be the organization True Patriot Love. So, meeting is adjourned. Merry Christmas, one and all. Thank you.